Well, this morning we move on now to the thigh gap craze. It continues. So many women doing whatever it takes to create that gap between the thighs, hoping to look and feel more attractive. Heidi joins us. She's in Scottsdale this morning to talk about this new medical procedure and how it works. Good morning.
Hey, good morning, Kaylee. Yeah, this thigh gap craze came about, I think, a little bit more than a year ago. You were seeing a lot of pictures posted on social media, and a lot of girls were doing this in not a safe way, maybe not eating enough or going to drastic measures to achieve that thigh gap. Well, now the FDA has approved a procedure that will achieve that for you. We're out at Shapiro Plastic Surgery in Scottsdale this morning where they offer this procedure. It's a Coolsculpting, and you may have seen this advertised on TV or on the radio, and so it's along those same lines, but this is brand new. So I want to introduce Christy. She's one of the medical assistants out here, and you perform this procedure. How does this work?
So Coolsculpting works through something called cryolipolysis, which is basically freezing the fat cells until they go through something called apoptosis, which is a natural cell death, and the great thing is the fat cells don't come back after treatment.
Okay, so Annette is our patient this morning. She says she's been battling some extra fat on her legs for over 20 years, so it was time for her to do something about it. Tell us what you've done to get to this point, to get her prepped so far.
So when Annette first came in, we kind of did a little consultation. I assessed her targeted area, which in this case was her outer thighs, what we call the saddlebag areas. I have to map it out, draw on her, put on a gel pad that protects the skin, and then I've got to strap down this Cool Smooth applicator to the outer thigh, and then she will have that applicator on for 2 hours. She can lay here and relax, watch TV, get on her iPad, whatever.
And what is she going to be feeling? We're not going to turn the machine on because she doesn't want to be here for 2 hours today, but what will she feel as this is happening?
Actually, it feels pretty good. This will just feel cool. There isn't any suction with this particular applicator. There isn't any discomfort. It just feels a little cool, and after a couple minutes, it kind of goes numb. So you're really very comfortable.
All right, and the results are pretty noticeable after one treatment?
You will get 20 to 25% of the fat cells that will die with each treatment.
All right, now she's having it done on the outside of her legs, and you just said diet and exercise, they just weren't cutting it, because you did try everything.
Everything, yes. I've consistently exercised for 20 years, so yeah, it's just not...
So you were probably thrilled when you heard that this had been approved?
Yeah, absolutely.
All right, we should mention too, she's having it done on her outer thigh, but this is also good for your midsection or the jiggly arms that a lot of women suffer with as they get older.
Yeah, we can treat anywhere where there's pinchable fat. We can use the traditional applicator, and if there's not pinchable fat, we can use the new Cool Smooth applicator.
All right, and this is the pinchable fat applicator that she's talking about. It actually goes in there. So this isn't cheap. It's about $700 per treatment, but if you're like Annette and you've been trying to get rid of this for 20 plus years, this might be a good idea for you. So we just want to let everybody know about it. Kaylee?